Hello, everyone, and welcome to EllieMD's weekly educational series. I'm Honey Sagari, founder and CEO of EllieMD, and I'm so excited to have you here with us to continue our mission to help people live longer, healthier lives. At EllieMD, we believe in empowering individuals through education, community, and innovative healthcare solutions to support vibrant living. Tonight, we're honored to welcome Dr. Adrienne Ingalla, a licensed doctor of physical therapy serving the Los Angeles and Orange County areas. With over 6 years of experience, Dr. Ingalla specializes in treating neurological and orthopedic conditions, focusing on improving functional mobility for adults in both rehab settings and at home. Dr. Ingalla earned her DPT degree from Boston University, following her summa cum laude graduation with a degree in exercise science at the University of California Lutheran University in 2014. I butchered that one, but passionate about empowering her patients to achieve greater independence and quality of life, Dr. Ingalla combines her expertise in movement science with a compassionate, personalized approach to rehabilitation. In this session, Dr. Ingalla will share her expertise on muscle preservation, bone health, metabolic wellness, and cognitive function. She will provide strategies to support these functions as we age, helping you live a longer and healthier, more active life. Well, thank you so much, Dr. Ingalla. Thank you for being here. Welcome.
Thank you so much for having me. I'm very excited.
I like to always start these with what got you to do what you are doing right now? Why are you passionate about being a doctor of physical therapy, and how did you end up here?
Well, it started in athletics. I thought that I really wanted to go into working with elite performance athletes. And so I went to physical therapy school. And in that time, we do a few different residence rotations, learning different care settings. And I really fell in love with our middle to older age population, working on their orthopedic issues, neurological conditions, because really it comes down to, can I do the things that I love doing, that I want to do, that I need to do to support my lifestyle, family, work, things like that. And so that's kind of how I shifted into the area that I'm in now. And I'm very excited to talk a little bit more about how I can help this population.
Oh, that's wonderful. Well, I want to start with talking about muscle mass, muscle retention. In the world of longevity, we talk about muscle strength and a direct correlation between that and longevity. Can you talk to us about why building and maintaining muscle mass contributes to longevity and why it's so important as we age?
Yeah, absolutely. So muscle mass in general, there's a little bit of a distinction. So one is muscle mass, which is just the total amount of muscle that we have on our bodies. And then we also have muscle strength, which is how much force can we produce with the muscle that we have on our bodies. And what happens is as we age, that naturally declines, more so for women than men, usually 2 to 3% every year after the age of 30. And so when we maintain our muscle throughout our lifespan, we're setting ourselves up for the future to have stronger legs in order to do things like continue to get up from a chair, walk faster, long distances. And these are all predictors of having independent, healthy, strong lifestyles as we age. So with longevity, it's important that we have that strong core of leg strength in order to maintain the function as we age.
How interesting, because I did come from the world of, I worked with the aging population, and I came from the world of home health care. And, we saw it over and over as the mobility reduced, so did the quality of life in general. So can you talk to us about why specifically leg strength is so important? You touched on the core, but specifically why leg strength is so important as we age.
Yeah, our legs are our primary movers. So most of what we do on a daily basis, standing, walking, lifting things. Really, a lot of that comes from our leg strength and endurance. And so that's kind of the foundation of not only our mobility, but also balance. So we use our ankles, hips, and core for functional balance. And as we age, we know that that's really important for maintaining independence, preventing falls and hospitalizations and things like that.
I love that. Now, can you talk to us about what role muscle preservation plays in preventing age-related health issues such as osteoporosis and metabolic decline?
Yeah, so muscle preservation is really important. We'll go into a little bit more about osteoporosis in a bit, but it prevents functional decline by keeping you strong and active. And then can you repeat the second part of that question?
Yeah, what role does muscle preservation play in preventing age-related health issues? I think we touched on this briefly, but as far as mobility goes, but how about metabolic decline? What role does muscle preservation play in metabolic decline?
Yeah. So our muscles are one of our primary absorption mechanisms for glucose. So after we eat a meal, our bodies will, go to our muscles and say, hey, we have an influx of glucose in our system. We need to absorb it and store it somewhere. And skeletal muscle is the optimal place that we want to store it because we know that it's going directly to a source that we can use it later. If we have excess glucose floating around in the system that our muscles can't absorb, either because of metabolic dysfunction or we don't have enough muscle mass to begin with, then that excess glucose can be turned into adipose or fat tissue. So metabolic health is really the key when we talk about maintaining muscle mass so that you have those sponges throughout your body. We don't get those peaks and valleys of glucose. So our muscles help with that glucose stabilization throughout the day. And then also just really efficiency. If you're pulling that glucose directly into the source that you're going to be using it, then you can efficiently do things like exercise, do all of your daily activities to maximize the benefit.
I love that you give us the analogy of a sponge because also in the world of longevity, we call aging inflammaging, right? And as you get those spikes in your glucose, it causes a lot more inflammation throughout the body. So can you touch on that how important, I mean, you told us how important that is, but can you reiterate how important it is to reduce the inflammation in our body and maintaining, like, stabilizing our blood sugar through resistance training and other muscle building activities?
Yeah, absolutely. So anytime you have excess sugar floating around in your system, it causes system-wide inflammation. So it's not like, oh, I sprained my ankle and then it swells and then that goes down. That's really localized to one particular area. If you have hyperglycemia or high glucose in your blood system all the time, that is going to every part of the body that interacts with your vascular or blood system. So that leads to things like inflamed blood vessels. So that can lead to things like cognitive decline. If you're having chronic stress with some of the smaller vasculature in your brain, it can create inflammation and irritation in your internal organs, including your heart. So it can lead to heart disease. It can inflame your kidneys, leading to renal disease. And then it can also inflame your liver, leading to like buildup of toxins and inefficiency in your liver. So really having that muscle mass helping to balance out your endocrine system or your glucose levels throughout your lifespan is going to be essential for maintaining the low levels of inflammation throughout your entire body.
Mm. Now, can you talk to us about what key nutritional factors support muscle growth and maintenance, and how do they impact long-term health and longevity?
Yeah, absolutely. So obviously we know the number one supplement or dietary thing that we can influence with our muscle system is going to be protein. So overall, protein is number one in maintaining and building muscle. So if you're losing weight, or if you're even maintaining weight, but you're trying to maintain the muscle mass, because we know we lose it a little bit at a time as we age, protein is going to be really important. I would say I tend to recommend on the higher end, especially for any population who is going through any weight loss journey, if you have a history of significant weight loss, and then also if you're in perimenopause. I highly recommend an easy conversion, which is just 1 gram of protein for every pound that you currently weigh. So that's a really easy way of getting enough protein into your system. Another secondary one, which is very similar to protein, is the branched chain amino acid. And those are just like additional building blocks for building muscle mass as you age.
And where can we get these branching amino acids? What foods can we extract them from, or how do we obtain them?
Luckily, they're already in pretty much every natural protein source, whether that's going to be like meat-based protein, plant-based protein like tofu and legumes, and things like that. You can also find them in a separate supplement form as well.
Thank you for mentioning that. And how can consistent strength training routine help individuals maintain mobility and independence as they age, ultimately contributing to a longer, healthier lifespan?
Oh, this is my favorite part. This is what I like, really get really excited about. So our bodies are hyper efficient. They really like to do what's easiest and most energetically efficient throughout the day and throughout our lifespan, right? So if we are pushing our strength training and maintaining our muscle mass as we age, that means that we'll have that reserve for continued mobility, strength exercise, functional movement, like being able to do, like bending down and like picking up a grandchild or something like that. So that's really important to maintain as young as you are. You want to start now so that you can maintain all of the mobility and function as you age. And then another piece of that is finding ways that you enjoy movement.
Are there any specific exercises that you would recommend? For example, squats or, I don't know. What would you recommend to patients that they can do from all different age categories and groups?
So I would recommend any exercise that targets all of the major muscle groups. So that's going to be like your quads, your hamstrings, your calves, your glutes. Those are like the main muscles in your legs that you want to focus on. And then also focusing on functional core, postural muscles in your back, your shoulders, biceps and triceps. And then also the smaller but very important muscles in your lower back to help prevent injury. And so any exercise that is, comfortable and adapted to your current mobility, I highly recommend doing 3 to 4 days a week of those exercises and doing 3 sets of 10 repetitions of each exercise that you like. So whether that is going to be, going to the gym, getting a barbell and doing a back squat, if that's going to be grabbing a backpack full of things and then doing squats with that, like whatever activity is accessible and enjoyable, then I highly recommend that. So the basic outline is to do 3 sets of 10 exercises of every major muscle group in order to maintain and build strength. And you want to make sure that you're not just doing, okay, quick 10, going through all the exercises, and then you're done. The goal is to reach what we call failure. So every 10th repetition, you should feel like, I really could not realistically do more exercise at this particular load. without losing good form or, not being able to finish it successfully. So you want to hit 3 sets of 10, what we call to failure. And that's not a bad term. That just means that your muscle cannot efficiently and effectively and safely do that same repetition again, in order to get the maximal benefit.
Now, we have a lot of people, especially on this call, that are using GLP-1 medications for either longevity benefits or for weight loss. But for weight loss patients specifically, how does weight loss typically affect muscle mass, and what strategies do you recommend so that we preserve it?
So it's really common in any weight loss to lose some muscle mass. And the faster you lose muscle, the more at risk you are for losing muscle mass. Like I said earlier, our bodies are very efficient. So if you're not actively using your full muscle capacity, and that's why I talked about making sure you're going to failure. So using your full muscle capacity, then your body will say, well, we only need 80% of that bicep. So we don't really need the other 20%. Let's use those building blocks, that raw material, for something else, and it'll break that muscle down. That's number one. Number two is if you are rapidly losing weight, your body will also find alternative sources of energy. And muscle isn't the most efficient way that we get energy from our bodies, but muscle breakdown can generate energy. So that's also a potential risk with rapid weight loss. And then how do you combat that? Going back to my same recommendation of 3 sets of 10 exercises, I would err on the side of more aggressive if you're actively losing weight and doing 4 days a week of every major muscle group to maintain that muscle strength and muscle mass.
And how about nutrition? Getting adequate nutrition so that you don't lose the muscle mass, correct?
Yeah.
During your weight loss journey, yeah.
So another way to complement that is obviously, maintaining your protein intake, minimizing your excess sugar. So you want to help your system create that steady flow of glucose so that you're not getting peaks and valleys. You don't want to overstress your muscle system by trying to rapidly absorb all of the excess sugar. So maintaining, a relatively low sugar intake, especially with simple sugars. And then other things like hydration is essential. Not only does it help with having enough muscle, like hydration in your muscle for adequate contraction, it helps with slower digestion. So you can actually digest more of the protein that you're eating. It helps with digestive motility. Sometimes when we eat a lot of protein, it can cause either constipation or diarrhea. So maintaining adequate hydration can help with maintaining a natural flow in your gut. It also helps with maintaining skin elasticity. So if you're actively
Mm.
you want to stay hydrated for all those reasons.
Adrienne, let's shift gears and talk about bone density and the importance of mass when it comes to bone density and osteoporosis. Can you talk to us a little bit about that and why it's so important?
Yeah. So osteoporosis is the general decline of bone density as we age. So it happens naturally from about age 30. Women, it's about 2% a year, and then it significantly accelerates when you're in perimenopause. So as estrogen drops, your risk of osteoporosis goes up quite a bit. And so we need bone density. Basically, like your body is like a house. And as you age, you have cells in your body that, build and repair. And we want to make sure that it's not depleting your bone more than it's building your bone, right? So I kind of think of it as in terms of like termites. So as you age, your body is like your house, and termites come in and they take little bites as you age and things like that. So how we combat that is through progressive resistive exercise and body weight exercise. Okay, so in order to go in and fill all the little holes that are being made as we age, we need to make sure that we're adequately and appropriately stressing our bones to stimulate the bone growth. And we do that with resistive exercises and also weight bearing exercises like jogging, running, going upstairs, things like that.
That's so interesting. It's like there was a study that came out about the dentin in your teeth saying like if you chew gum that's sugar-free, it's actually it helps build the dentin in your teeth because of the same reason it stimulates that growth of the crystalline structure. It's so interesting to hear that it's the same exact thing with our bones that we need to stimulate the muscles so that the bone gets stimulated and starts preserving the bone structure. Um, Now, can you touch on pregnancy and osteoporosis and women who are in childbearing years or and how that affects bone density?
Yeah, absolutely. So when you're pregnant, your body is creating new life and it's trying to give every available resource to the growing baby that's inside you, right? So what's happening is if you're deficient in any materials, building blocks, minerals, things like that through your diet, your body will naturally direct it from your own body to the growing baby. So what happens commonly is that when you're pregnant, you tend to have lower bone density because your body is taking some of that calcification, that mineralization, and diverting it for pregnancy. And so it's important that you're maintaining not only calcium and vitamin D, but that even as you're pregnant, that you're doing appropriate resistive exercises and weight bearing activity to continue your own bone health.
Mm. So it seems like women are at much higher risk for osteoporosis. And because of pregnancy and all these, are the fluctuations in our hormones, and we'll get into that. But now that just brings it into perspective, the importance of resistance exercises and really stimulating the bone in order for us to maintain our bone structure. Um, can you touch on hormonal fluctuations as we age, especially when it comes to menopause, and that how that affects our muscle mass and then in turn our bone density? Can you elaborate a little bit more on that?
Yeah. So as we go through menopause, our estrogen significantly decreases. And then also thyroid and testosterone decrease a little bit as well. All three of those are vitally important to maintaining strong, healthy bone mass. And then on top of that, so they work independently, both on the bone system and the muscle system, but then they kind of can snowball together, right? If you don't have enough muscle mass, for adequate contraction and bone stimulation, then it can kind of snowball into losing both at the same time. So they both have signals and make changes in the bone system and the muscle system, but then also working together. Your bones and your muscles work together to keep each other healthy and happy.
Mm. So, guys, if you're on GLP-1 medications or losing a lot of weight, significant amount of weight in a short period of time, it just makes it even more important to maintain that muscle mass. That's what I'm hearing over and over, because then that leads to healthier bones, which ultimately leads to longevity, right? I mean, am I
Mm-hmm.
painting this picture correctly? They all
Yeah,
work together at the
they
same
all
time.
work
So if you're
together.
a woman, you're at higher risk of osteoporosis, and then combine that with the fluctuations in our hormones and significant weight loss, and oh my gosh, right? um so do you want to elaborate any more on that, Adrienne, and what we can do? Can we also supplement with calcium, anything else besides calcium and protein?
Calcium, protein, definitely vitamin D that helps with co-synthesis and absorption of calcium. And just to go back to your previous statement, so women are uniquely at risk because of hormonal and pregnancy factors. But I will say this kind of applies to everyone in general. And it doesn't matter at what stage of your life you're at, every single person needs this progressive resistive exercise to maintain healthy bone and muscle structure because Even men will lose 1 to 2% every year from the age of about 35. So this kind of applies to everyone along the continuum of their lifespan. And it seems kind of overwhelming. You're like, oh my goodness, I have all these things. I was pregnant, I'm losing weight, now I'm going through menopause. But it really all boils down to, luckily, one very reasonable and simple answer: just maintain your muscle and bone mass through healthy exercise and eating, supplementation if you're not able to get that adequate nutrition through natural food. So that kind of ties it all together. It's like there are a lot of different layers of complexity, but ultimately it comes down to that one recommendation.
And as far as bone density goes, once you lose it, is it repairable? Can you get it back, or is it like once it's done, it's gone? Oh no, can I start today, or is it too late? I guess that's the question.
It's never too late. So our bodies are extremely adaptable. We used to think that you were born with the amount of cells in your brain and that was it. Now we know about neurogenesis, that as we learn new things, we not only make new connections, but we also generate new cells in the brain. So the same is true of your muscle and bone. So just because you have osteoporosis now doesn't mean that you can't reverse it through adequate exercise and nutrition.
Okay, so if I've never stepped to the gym, it's very intimidating. Is there anything I could do at home to get started before I go to the gym? Is there anything you recommend? Maybe holding cans of beans in my hand? I don't know. Is there like squats? What can I do? Just paint the picture for me so we can get started.
I would say getting moving with your own body weight is the best place to start because your body is used to moving yourself around. So finding any movements that are, safe and comfortable, they're not causing you any new or, ongoing joint pain, things like that. So, going back to the basics, can you squat? Can you lunge? Can you do a push-up? Can you push yourself up from a chair without using any of your leg strength? So just using all of your arm strength. Those are like really easy things to kind of get started on. But the really important part too is like that's just the beginning. So you want to like condition yourself to do some of these exercises and be okay with feeling challenged, because ultimately you're going to get the most benefit from this if you're adequately challenging your body. So if our body thinks it's too easy, it's not going to continue to build bone and muscle. So you want to make sure that you're eventually hitting that failure part as you get more comfortable with some of these movements.
Okay, we're going to make this a challenge on the call. As soon as we all get off, we have to do 20 push-ups. Got it. Now, just going back to the metabolic health and longevity, this is really important. Maybe go back to explaining the importance of the muscles acting like a sponge, but can you also talk to us about how maintaining metabolic function impacts the aging process and prevents disease yeah, maybe you could touch on that. Let's start there, from preventing chronic disease, metabolic health and preventing chronic disease. There you go.
Okay, yeah, absolutely. So let's just take it through like one example. So let's say you have never exercised before, you're really uncomfortable with exercising, and then you are naturally aging and you're losing weight, and some of your muscle mass has gone down. All right. So now you have smaller muscles and less of that absorption of your glucose from meals. Okay. And so as you're eating your normal food, your balanced diet, but your blood sugar is spiking. Every time you eat, your blood sugar is like significantly going up. What happens is the irritation of the systems internally. So let's say you have hyperglycemia and it's irritating your kidneys. Okay. So basically what happens is that you lose the efficiency in your kidneys because they're chronically inflamed. And what can happen then is if you don't have adequate kidney function, it's not going to filter out toxins and things like that. So that can inhibit longevity because you'll need to like dialysis. Another example of this is chronic irritation of the blood vessels from hyperglycemia. So if you have chronic irritation of the blood vessels, you increase your risk of having a stroke because you don't have the normal elasticity in your blood vessels to expand and contract like as your blood pressure rises or decreases. So if you have a stroke, then you're more likely to lose, cognitive function, functional mobility, so muscle strength, things like that, depending on where the stroke is in your body. And then from there, then you decline in function.
Mm. And you touched on hydration being very important as part of that process too, right?
Yeah, it is.
Yeah. Now, can you let's shift gears and talk a little about cognitive health and cognitive functioning as we age. What are some key factors that support brain health and cognitive function as we age?
Okay, so one of them would be like cardiovascular exercise. So that helps increase the blood flow to your brain. So adequate blood flow means adequate nutrition. And then also maintaining good social relationships is really important for cognitive function as we age. Hydration is important. And then also things like mental stimulation. So we all know that one person who like worked until they were 90 and they lived a very full and independent life. Cognitive stimulation goes a long way with longevity. Not only does it keep your brain sharp, but it also keeps you purposeful in your movement. So it keeps your body functioning well as well.
Mm. Now, can you tell us how maintaining muscle mass correlates with cognitive abilities?
Mm. So muscle function is important because it helps you with all of the things that we just talked about. So if you have good muscle function, you're more likely to be mobile and leave your house and socialize. You're more likely to be able to do the things you enjoy as you age, whether that's working longer, if you enjoy your job, volunteering, things like that, or like going to help and support your family, spending time with loved ones. So those are all things that are important for maintaining the longevity.
Yeah, and also our insulin levels play a huge role in cognitive health and function. So, right, it also helps stabilize our insulin. So that's really important. Now, can you share practical tips on how to incorporate mental activities into our daily routines to maintain cognitive health?
Um, hmm. I use this with my patients with things like cognitive dual tasking. So we're doing a physical activity and we're also doing a mental activity at the same time. So being able to walk and talk is actually a skill. It's a skill that you have to maintain because you're doing an automatic balance and mobility system while you're also doing a different part of your brain is working on maintaining conversation. And then you can take that to a higher level, right? So you can be going for a run and listening to an interesting podcast and learning something new. So working two different systems at the same time. Obviously, you want to do that safely. Don't do that in LA where there's a lot of traffic. Find somewhere where it's safe to do that. But being able to retain and learn that information while you're doing an automatic task helps maintain brain and cognitive function as we age.
Oh, that's great. Easy. I can walk and talk all day. Yes, I got this. Now, can you let's talk about holistic approaches to longevity. How can an individual integrate various health practices like nutrition, exercise, lifestyle changes for optimal longevity? So, like, let's talk holistically, bringing it all together.
Yeah, there are a lot of different pieces at play as we age. Obviously, exercise and nutrition. We kind of touched on the cognitive function already. I cannot stress enough how important socialization is and purposeful life is as we age. That is a huge determinant. There have been a lot of research studies about how social connections keep us alive and independent living a lot longer. And then it also helps with mental health, preventing depression and isolation. We kind of learned about that, how being homebound and, by ourselves during the pandemic can take a big toll on your mental health as well. So also going back to the holistic approach, so identifying other areas to reduce stress, improve sleep quality and time sleeping. Those are other kind of holistic things that I like to touch on with my patients, because they're all the foundations that help us do the things that we find meaningful and want to do for the rest of our lives.
I love that. It's so important. I think if anyone here on this call has aging parent or loved one, I know coming from the home healthcare world, we would tell our CNAs, nurses, allow the patient to do as much as possible for as long as possible. Because as soon as you extract that from them, that's when the cognitive decline begins to happen, the physical decline. So just having that purpose of like cleaning the house or, washing the dishes, whatever it may be, so important. And you're so right. As we age, it's important to have the socialization and that purpose, and not losing that. Now, can you share success stories of your patients, or any individuals who have adopted a holistic practice for long-term health and vitality?
Yeah, absolutely. I'm thinking about one patient that I have right now. He has had significant decline in mobility. He was diagnosed with cancer like more than 30 years ago. So he's been cancer free for 30 years, which is really exciting. He also had 2 minor strokes. And then, so I have worked with him for rehab for over 2 years. And we not only talk about like, how is he moving? How independent is he? We're talking about how often is he leaving the house? What kinds of activities does he like to do? Not only that, but then I am also coordinating with, his dietitian to make sure that he's getting all of the adequate nutrition that he needs to maintain muscle mass, because he's aging, as we all are. And then also addressing sleep positioning, sleep quality, maintaining adequate hydration. So these are all pieces that I'm pulling together. And then also getting all of his loved ones really involved to make sure that they are in support of him, in support of his plan, and that they're implementing some of these things into their routine as well. Because even if we're not going through it directly, we're always in this community of other people. So I'm talking to his daughter. Hey, are you eating well? Are you sleeping well? Are you hydrating? And so it's an all interconnected web of making sure that we're all supporting each other. So not only holistic to the person, but it's like their community that they live in as well.
I love that. Now let's talk a little about injury. About a month and a half ago, I had a tailbone injury and it just took me out. I couldn't go to the gym. It was painful. Now, what can we do? And mine didn't come from the gym. I actually, someone pulled the chair from right under me.
Oh
And
no.
I sat down and I fell in the wrong place on my tailbone. So that was a long healing process. But let's talk about avoiding injuries. What are the most common injuries individuals experience during exercise? And how can they be prevented?
So the most common injuries I would say would be joint pain and muscle strain. And typically that comes from less optimal technique or doing too much too soon. Typically, people are maybe new to the gym and they're like, I'm so excited. I'm going to take this information that Adrienne gave with me and I'm going to run with it. I'm going to go do 30 squats with as much weight as I possibly can. And maybe it's not that extreme, but to some degree, people are doing a little bit more, or they're not using good form. And they're most of the time musculoskeletal injuries like joint pain, back pain, knee pain, hip pain, or a strained muscle. And how can we prevent those? Well, we can certainly start with really good form, starting with low load and then progressively building up the weight or the effort that we're giving at a time. And then working with a professional to build a program and develop the system that you need to help with injury prevention. This is especially important if you have a history of injuries. So physical therapists are obviously really good at taking not only where you are now, but what have you had issues with in the past, and kind of building an exercise program that's appropriate and that's not going to injure you in the future.
And can you talk to us about warming up and cooling down? Why are they so important and why we need to incorporate them into our routine?
Yeah. Warming up is really important for blood circulation. We want to make sure that we're getting adequate like oxygen and nutrients to all of the parts of our body that we're going to be using. So I typically recommend like 10 minutes of any total body movement that feels good, whether that's like going for like a jog before you lift, or something like doing up and down the stairs before you, I don't know, lift heavy weights, things like that. So warming up is really important. And also because our body is, when we're doing heavy exercises, like I'm recommending, your body is creating muscle strain in a very small way. And we want to make sure that it's preparing to do the work that it's going to be doing without kind of jarring it into doing that heavy load. So we want to start with a very small and easy load, like walking or going for a light jog, before we ask those muscles to be doing something a little bit more intense. And
Mm,
then for cool down, I recommend like anything that can help slowly decrease your heart rate. It only needs to be about 5 minutes long. If you're doing about like a 30 to 45-minute exercise, and then ending with stretching for mobility
yeah.
at the end.
Yeah. Can you elaborate on stretching? Like, why is it so important to incorporate stretching as part of our routine?
Yeah, so maintaining flexibility is important in being able to do the functional activities that are safe and maintaining good form. So one example that I love to give is like when you bend down to pick something up from the floor. We all know like we're supposed to lift with our legs, right? But if our hamstrings are really tight, it's going to be really hard for us to bend over to get to the floor. So if we maintain hamstring length and flexibility, then we can more effectively use our legs for lifting than using our back to make up the difference for our short hamstrings.
Mm. Yeah, the stretching also, I've been told you can't start stretching right away. You have to first warm up because it's like a rubber band that could snap. So you got to warm it up before you do your stretch. Now, what types of exercises are particularly effective in preventing injuries, especially in high risk areas like the lower back or knees?
Mm. So I would say the best exercise you could do to prevent injury in the back and including the knees is functional core exercises. So that is not sit ups, not a straight sit up. It's being able to use your entire core, so bracing while you're breathing and moving. So you're using your internal stabilizers to make sure that you're not using your smaller muscles for like stress. And then also, as women, we also need to be really conscious of the bottom part of our core, which is our pelvic floor, and maintaining pelvic core stability underneath as well. Because if we're just bearing down and doing a lot of, core contraction here, but we're not conscious of any contraction on the bottom of our core, our pelvic floor, then we can be creating a lot of stress down there as well. So maintaining the full wraparound and bottom of our core while we're doing any exercise will prevent most injuries. Also, because if we're keeping our core and pelvis stable, then our limbs are free to move and do the things that they need to do. And then we'll reduce injury for like the back and hip.
Now, do you find in your patients, or do you in general publics, in general populations, do you find that men and women have different types of injuries that are pretty common to them? I know when I do deadlifts, I always injure my back, but are there, common exercises or injuries that you find in specific populations?
It is more common for women to have like ligamentous injury when they're pregnant because of laxity hormones. Um, those
Oh,
same
interesting.
hormones, to a very small degree, cycle through our cycle. So if you're premenopausal, you are more likely to have injury at certain parts of your cycle because of your hormone fluctuation and laxity. But women in general tend to experience a lot of the same injuries as men, especially as we kind of push ourselves more into the male exercise space, or spaces that traditionally only males really were like doing, like heavy Olympic lifting, things like that. Um, Women also are more likely to have like ankle and hip instability because physiologically we have wider hips. So there is less knee stability because of that. So we want to be really careful of knee and ankle stability when we're doing exercise.
You just threw in the laxity hormones. So you just threw it out. Let's elaborate on that because that's very important. We have a lot of women on this call, and so can you touch on those hormonal fluctuations and what that really means for injuries and for other health purposes?
I would have to go back to the specific study, and I think women in general are very different in their cycles. So I would refer back to that study and also say that everyone is very different. So just being aware of how you're feeling at different points in your cycle, because that can influence your joint stability.
Interesting. Now, um, I guess I asked the question of what we can do to prevent injuries. Are there exercises that we should just abstain from altogether because we're more prone to being injured, like deadlifts for honey? To stay away from it, but what are they, and what is the cause, I guess, ultimately? Is it just bad
So
form, or is it, muscle structure, the wide hips, or form? What is it?
there's no one particular exercise that I think everyone should avoid. I think it really comes down to good form. So if you're feeling uncomfortable with any particular movement, finding someone who can analyze and adjust and make recommendations based on your particular body and how you're functioning and doing things, is going to be the most applicable advice.
I love that. Okay. So I need a better trainer
But
then. Janet, get
well,
on it.
there are some few questions in the chat that I wanted to bring up, if that's okay. Mary asked, is lactic acid buildup from too much exercise?
I wouldn't say it's from too much exercise. That's a really good question. So lactic acid is built up in like from sorry, from exercise, and it is slowly broken down and reabsorbed in our liver actually and converted back into glucose. So it's not from too much exercise per se, but it can be from too intense of an exercise in a very short amount of time if your body is not used to it. So you could be a long distance runner, running, and then let's say you go on vacation and you take 2 weeks off, and then you go on a long run again. You're going to feel that lactic acid build up in your muscles because you've lost, for just a short amount of time, the efficiency of absorption of that lactic acid into your liver to convert it back into glucose. So it's not from too much exercise, but it could be from just an overload of exercise for a short amount of time. And sometimes that's a good thing, as long as you're able to walk the next day.
Now, is there anything we can do to process that lactic acid and eliminate it from that region or out of our bodies?
Light walking or gentle exercise. Some people like foam rolling. They're trying to like squeeze it out of their muscles, but really the muscle pump action of working that muscle in a light way can help clear some of that up.
Now, how about cramping? Can you elaborate or touch on muscle cramping? Some people experience that in their, calves, their heels. What causes that, and what can we do?
It's typically an electrolyte deficiency. So making sure that you have either electrolyte tabs on hand. I've even heard like mustard packets because they're salty, whatever you like. But something that can get quick electrolytes like sodium into your system because we need those for adequate muscle contraction. And if we don't have them, then your muscles can't adequately contract and then relax. And that's how you end up with a cramp.
Thank you. Vanessa asked, what stage of the cycle does the elasticity increase?
I will defer that question to research.
All right, we'll get back to you, Vanessa. Google. Now, let me just finalize my questions on the injury. How do we approach rehabilitation for an injury, and what are the key stages to recovery to ensure full muscle and joint function?
What was the question part? Say that again, sorry.
No problem. How do you approach rehab for an injury, and what are the key stages to recovery to ensure full muscle and joint function?
Okay. So it really depends on the type of injury you have. And there are, I would say, 3 major stages anytime you're dealing with an acute injury. So something that just like an ankle sprain, right? You have the healing phase where you're trying to get actual structural changes to heal. So for an ankle sprain, that's like laying down collagen and scar tissue, things like that, getting some of the swelling out. And then my second stage is return to functional mobility. So that's going to be like returning to being able to do the stairs like you normally do instead of having to be like locked up in a boot or something like that. So returning to the activities that you need to like live a very basic life. And then the third one is going to be return to like enjoyable or exercise activity. So getting back to running and things like that. So those are the 3 stages that I would typically take someone in for a rehab. And it just depends on the type of injury it is. So you're going to see an ankle sprain. It's going to be very different than pulling a muscle in your back, which is also going to be different than, a hip fracture or something like that. So the timelines are very dependent on the structures that are involved.
That's good to know. Now, are there any specific nutritional supplement recommendations that you have to support recovery from injury and to prevent future injuries?
I would say real diverse nutritional food is number 1, because that's going to lay the foundation for all of your, not only macronutrients, especially protein, but also all of your micronutrients and minerals and things like that. I also like to recommend collagen because our body uses collagen in a lot of different places, both in muscle and like bone structure function. So maintaining adequate collagen intake is really helpful in accelerating any injuries that come across.
That's good to know. Well, any other recommendations, Adrienne, as we wrap up tonight's call? Anything else you'd like to enlighten us with? Anything else we should know?
No, I think we've touched on a lot of different aspects of longevity, maintaining and gaining muscle strength and bone density health. Ultimately comes down to using your body to its fullest potential and maintaining a healthy lifestyle now so that you can continue to have an active and independent lifestyle as we get older. I think it all starts with today. You just do your 3 sets of 10 exercises today, and then do it again the day after tomorrow, and then the day after that, and then continue on your journey.
I love that. Well, thank you so much, Adrienne. If we want to find you, where can we find you? Is there a way we can get in touch?
Sure. I'm available by email. I'm very old school. I like to spend a lot of time focusing on my patients. So you can email me the old-fashioned way at adrienne.ingalla@gmail.com. That's the best way to get in touch with me. If you have any general questions or want to schedule a session with me, that's the best way.
Well, thank you so much, Adrienne. And thank you all for joining us for another week of our educational series. We hope to see you next week. Thank you all so much. Have a wonderful night. And if you can, go do some push-ups, go do some squats, go do some activities or walking. Thank you all so much. Have a great night. Mwah.